HIV is still considered a top global health threat as it emerges in new demographic groups. More than 25 million people have died from the AIDS pandemic since 1981. While it's not always a death sentence if you're treated properly, that doesn't mean we've stopped the disease or yet found a cure.
HIV progresses to AIDS at varying rates. Without treatment, AIDS can potentially take a victim's life in a very short amount of time. And despite the fact that celebrities like Bono, Magic Johnson, and Elton John have been working to raise awareness, up to 6,800 more people are infected every day around the world. As a blood-borne pathogen, the leading causes of transmission are unsafe sex, contaminated needles, breast milk, and mother-to-infant transmission at birth. The increase in antiretroviral drugs and cocktail therapies are helping people live healthier, longer, and more productive lives. Still, more than 2 million people worldwide died last year from AIDS-related illnesses. There are still a tremendous amount of research and discoveries to be made, but most importantly, awareness and education need to continue and grow. The faces of HIV and AIDS reflect every age group, ethnicity, and economic bracket. And it's not original, but it is true. If one of us has AIDS, we all do. The fight is far from over.
Of the 56,300 people in the U.S. who will be infected with HIV this year, almost 18,000 will be women. Why is this happening, and could you be one of them? Here to shed some light on HIV are Regan Hofmann, author of I Have Something to Tell You, and editor-in-chief of POZ magazine, and Dr. Brett Mandefro, a public health physician who reaches out to at-risk women from Washington, D.C. to Ethiopia. She's the founding director of Truth AIDS. Welcome to both of you. Thank you for being here. So today is all about shedding light on HIV, removing the stigma. And I want to start with you, Regan, because you're from Princeton, you went to prep school, spent your summers in the Hamptons, you rode thoroughbreds, but you had a secret for a decade. Mm-hmm. What was that secret?
The secret was that I was infected with HIV in 1996. And I got it from a guy who didn't know that he had it. And he found out when I found out and had him get tested. And I had been swimming with the dolphins in Florida with my mom and sister and found a little bump on my groin and went to the doctor. And long story short, they never expected to diagnose me with HIV. And so when they came in and said, I have something to tell you, your blood work shows us that you're positive, I just about died. Because I've been careful, you know, I volunteered for Planned Parenthood, I was knowledgeable, but by the mid-90s, I was newly divorced, on the pill, didn't think that I was at risk for HIV. I was worried about getting pregnant again. So I was really stunned. And, you know, we believe that a woman can get pregnant from one act of unprotected sex, but I only had unprotected sex with this man twice and got HIV.
And, you know, as a gynecologist, that is very, very common. A lot of women will get focused on not getting pregnant and forget about the STD, you know, possibilities.
And I think a lot of women now, as the editor of POZ and getting phone calls all the time from women living with HIV who are newly diagnosed, women are finding out that they have HIV and AIDS on the same day because they've been through the medical system with symptoms, but the doctors aren't looking for them, and they're not thinking that they could be at risk. And so I lucked out. I mean, I had this bump on my groin, and otherwise I probably wouldn't have gotten tested. And it saved my life because I found out early. But that was
one of the common themes we're talking about on today's show, emerging health threats. A lot of the symptoms are the same. They may be, I just don't feel quite right. I feel weak. You know, okay,
yeah.
And a lot of times, if you're not thinking outside the box, because you're certainly not someone we consider high risk at all.
No.
And what's beautiful about you spreading this message is you're removing that stigma. And so now you offer advice to a lot of young women. So what advice or what questions are they asking you?
Well, it's funny because when I go and I talk at schools, high schools a lot of the time, or middle schools, they say, now you're not going to get any questions, you know, from the kids.
Chock full of questions.
Chock full. The minute I stop talking, all the hands shoot up in the air. And because a lot of children were taught abstinence-only prevention, a lot of the young women in particular think that if they've only had anal and oral sex, which they have to protect their virginity, they're not at risk for getting HIV. And so I've got 12-year-olds, 14-year-olds in the audience telling me that they're sexually active. And it's not that, I don't want to hear it any more than their parents want to hear it. I don't have children. I don't know what I would do if I had a 14-year-old that I had to talk to. But we have to talk to our kids because they're going to die if we don't.
Anytime you have unprotected intercourse, you've got to get tested. Or even with protected intercourse, if you've had multiple partners, you should be tested.
And now it's not even just young people, because Dr. Mendeffer, you're talking now about seniors. Medicare does cover free HIV screening, but
that's right.
Elderly are having unprotected sex, and you're finding that they're at risk for HIV.
Well, you know, this is a whole story around risk perceptions, and we just got to tell people that everyone's at risk. That's the message. You know, we need to link unwanted pregnancies, STI testing, HIV. It's all the same thing. Prevention is an active process. You need to think about it every day, and we don't do that very well.
Women need to know, or all people need to advocate for their own sexual health. And what we need to teach people are the tools in those moments. It's not just about wearing a condom or getting that message out there, because it's hard. It's hard to make men wear condoms. It's hard to bring it up. It's hard to enforce that, like you were saying.
There's a control issue. A lot of the studies have shown, especially in heterosexual sex with women, men still control condom use. End of story.
Get women to take that in control and know that it is okay for you to have condoms, for you to initiate that, or for you to initiate the contraception that's going to protect you against STD and not just pregnancy.
And actually practice the conversation that you would have in that moment.
Showtime is actually currently airing a Pure Land Pictures documentary of your work. It's called All of Us, and we have a clip of a true circle, but I want you to set that up for us.
Sure. Well, I was telling you, staying HIV negative is an active process, and what you're going to see is a group of women that are actually my friends in New York City, very diverse, and we're trying to demystify risk. So I ask them a series of questions, and they share a lot.
Take a look at this.
What this is supposed to be is kind of a model of the first truth circles, what we're calling them. So what I'm really trying to do is draw the parallels between what my patients' lives are and then what my life is, actually, because as I look at my peer group and a lot of the decisions we've made in our own personal lives, they're actually not that different.
With the person I'm married to now and a serious relationship I had before that, I stopped using condoms actually pretty quickly in both relationships, probably too quickly. I did have some complaints from some guys that I've been with that they don't enjoy it as much, or they like can't lose their erection, and then whatever, like the sex is not as natural.
When you think about like, okay, he wants to have sex. If you're not gonna have sex with him, then he'll go out and have sex at a place. Yeah, it's horrible.
I have a hard time saying no because I don't want to hurt his ego, and I'm such a diehard feminist outside of the bedroom, but in the bedroom, I'm just straight punk.
And now I think all of us are saying we've done that, and all of us are finding this totally easy to relate to.
What's the number one reason people don't get tested?
Fear, and because they don't think they're at risk.
Fear. And that's such a common thing. Well, after the break, we're going to teach you how to protect yourself and your loved ones from contracting the HIV virus. And then later, we all know that global warming has caused more severe weather systems, but how is it affecting your health? That's all coming up.
People say, oh, safe sex is sexy sex, but it actually is.
Invite